So I'm just recording this video. I'm in operating theatre today, and we've just finished really quite an interesting case where we essentially rectified abnormalities in a person's fallopian tube to optimize them for IVF. And I just thought we'd sort of share this case with you because I think the fallopian tube, once we get into IVF, is often ignored. And that's partly correct in the sense that for IVF, we really don't need functioning fallopian tubes. But the reality is when there is something so wrong with the tube that it can actually affect IVF outcomes, even though the IVF bypasses the fallopian tubes. And that really comes from when the fallopian tubes are so damaged that they are blocked on one end and they swell. And that swelling is generally an inflammatory response, and it collects fluid that has a lot of inflammatory chemicals, what we call cytokines, in it, and it can't flow back out the fallopian tube, the end of the fallopian tube that's closer to the ovary. And what happens is that fluid backtracks back through the fallopian tube and into the uterus. Because there's so much inflammatory chemicals in this fluid, that if an embryo is at the same time trying to implant and it gets constantly bathed in this fluid that is inflammatory in nature, then it really inhibits implantation or makes implantation difficult for the embryo. So you drop your pregnancy rates, and you also potentially can increase rates of things like miscarriage, though the data for that is more contentious. So these are called hydrosalpinges if they're filled with fluid. If they're filled with pus, they're called pyosalpinges. And if they're filled with blood, they're called hematosalpinges. And before we transfer an embryo, these need to be dealt with. They can be dealt with in a couple of ways. They can be dealt with medically by giving antibiotics, though the evidence for that is fairly scarce, and it's really for people who can't do surgical management, and really surgical management is the mainstay. So surgical management is where we either remove the fallopian tube altogether, which obviously has impacts on trying to conceive naturally, but keeping in mind this tube is already damaged. Or we can try and correct the deformity in the tube. The success rates are variable. Or we can actually block the tube at both ends. So the one end is already blocked by whatever process caused the blockage in the first place, or caused the hydrosalpinx in the first place, whether it's inflammatory, endometriosis, and so forth. But we block the other end so that this fluid can't actually escape back into the uterus. So normally we can put a clip on. Sometimes we can use X-ray technology or interventional radiology to do this as well. So what we actually did in this case was that both tubes were abnormal, and one tube was so abnormal and stuck down it was quite difficult to fix surgically, so we put a clip on that. And the other tube was less abnormal but had a lot of scarring around it, but it was not blocked, it was free flowing. And what we ended up doing is we actually took down all the scar tissue in a process called a salpingolysis, where we actually corrected the anatomy of the fallopian tube, which was nice to do. And then by the end of it, the tube looked very normal. We tested it, it was nice and unblocked, so we've left that tube alone. So I just thought we'd share this video with you because I think the fallopian tube is often ignored in IVF, because yes, we do bypass it, but the reality is if you have an abnormal enough fallopian tube, it will affect our IVF outcomes, and we really should fix these before we transfer embryos in.